Hello and welcome to Pulse, your podcast delving into all things health, innovation, digital and data, proudly brought to you by Pulse IT News. This is our Hot Topics show and I'm your host, Louise Schaper. So I'm jumping in here to welcome you to part 2 of our conversation, breaking down the biggest healthcare story of the moment, which is, of course, Big Tech's decisive move into generative AI for health. Now, when George and I sat down to discuss this topic, we had so much to say that it would have been a very long episode. So what we decided to do is to split the episode into 2. So today's drop is part 2. If you haven't listened to part 1, I suggest you go back to last week's episode and listen to that one first. So to recap, in January, we saw major announcements from OpenAI, Anthropic, and Amazon One Medical, signalling that healthcare is no longer a side experiment for AI companies, it is a core vertical. In part 1 of our discussion, George and I explored what ChatGPT Health and Claude for Healthcare actually mean for consumers, why generative AI could become the default digital front door to healthcare. I actually think it already has for many people. How this shifts power, trust, and expectations in the clinician-patient relationship, the realities and, of course, the myths around privacy, misinformation, regulation, and safety, and what this moment means for healthcare business models, vendors, and startups. In today's show, part 2, we continue the discussion by diving into the impact on our hospital and healthcare organisations and systems. We make some predictions. We give a practical to-do list for you, for all health leaders. George and I had such a great time exploring this topic, and your feedback has been excellent. And thank you for taking the time, those who have reached out. So after a word from our sponsor, we will dive straight in and pick up where we left off. All right, welcome back, everybody. So now we want to focus on the B2B, the business-to-business enterprise AI models. So a couple of things. So Anthropic, they've released an enterprise tool that means Claude AI can connect to ICD-10, and it's also very US specific at the moment. So it connects to the US Centers of Medicare and Medicaid Services coverage database, so basically your insurance that you get through Medicare in the US. And it also connects with the US National Provider Identifier Registry, which alone can make provider identification, verification, credentialing, directory management, etc., much more efficient. They've also added an agent which will do the FHIR development for you, making interoperability easier for developers. So that's Anthropic's, a summary of Anthropic's play. And then ChatGPT for healthcare, what that model, as opposed to the one that's for consumers, this one is a secure workspace for clinicians, hospital administrators, researchers. It also offers an API path for HIPAA-aligned deployments, which is based on workflows, evidence retrieval, enterprise governance. So with this, OpenAI is really positioning itself as the default interface for clinical knowledge work. They're explicitly talking about cited evidence, templates, governance, and organizational controls. So I think what they're trying to do here is to convert, let's say, shadow AI, for want of a better term, into enterprise AI. They know that, look, clinicians, there might not be a proper policy in place, or the policy might say, no, we don't use these tools at our fine establishment, but we know that clinicians are using general AI tools informally because their organizations are slow to adapt. And so OpenAI here is basically saying, okay, fine. What we'll do is we'll give you a compliant-ish workspace so that you can at least standardize use. So, these are early days for Anthropic and ChatGPT or OpenAI, but they're making a play for that B2B space as well.
Yeah, look, I think this is going to be a much harder journey because in the consumer space, they're moving into a vacuum. There are no consumer tools out there, or very few consumer tools that have the same sort of value. And the open AI tools available are leaps and bounds better than what's out there at the moment. Once you go into the enterprise space, you start hitting enterprise barriers. For example, if you're running Epic and Epic doesn't enable you to integrate with their system, then do you throw away your $1.5 billion Epic implementation and replace it with OpenAI? I probably don't think so. So again, here they're hitting a competitive market, and they may find that the incumbent is quite resilient. So we know in the hospital market, there's a couple of key players. In the general practice market, there may be a bit more flexibility because the players aren't quite as big. But again, that's only here in Australia. In other parts of the world, there may be stronger players in that space. So I think they'll need to work out where they add value. And to just say we have a workbench, what does that actually mean? Do I still need to enter my information into Anthropic and into Epic? Is my information in Epic accurately transformed over to Anthropic? If something goes wrong, is it Epic's fault or is it Anthropic's fault? I think there's a whole bunch of issues that need to be understood there. And in the enterprise market, people making decisions about how they spend their money, I think that the incumbency of the big EMR systems is probably going to protect them for a while. But again, that'll change over time as people get used to doing things in an AI way. And we've already seen Epic and the new Oracle health systems are very different to the Excel spreadsheet type models that I used when I was working in the hospital 20 years ago. They're much more interactive. They're much more chatbot enabled. So I think we may see the incumbents becoming more like Anthropic or more like the AI tools, but still maintaining some of that core functionality, which we've become used to.
Yeah. And reading through this, and it is difficult. It's early days, of course, and you're right about all the barriers and the incumbency that is very strong in many healthcare systems. But I was thinking about the spine that the UK have been threatening to build for a long time, like a decade or something. But the idea that there's one EMR to rule them all and all the data is going to sit in there and everything has to integrate into the EMR is a very antiquated business model. It's still a predominant one and predominant thinking, but it's not going to last. So what the UK have talked about building is they've called it the spine, where you've got an EMR, a GP system, the system from your chiropractor, from your dietitian, doesn't matter. Could even be wearables and information that consumers generate. But you've got this spine, which is basically your interoperability layer based on standards and interoperability. And so the data collected about you or by you that sits in all these different systems, that data can all be easily shared with the spine and identified. So there's one George Margelis. And certainly when you think about when we had Peter O'Halloran on the show last year, talking about his plans for interoperability and what it looks like, that's the sort of description he would give, that your ambulance, wherever, they can get data from you from multiple sources very quickly and know that it's correct. And so that's what I'm thinking. I'm wondering whether this is part of the play for like Anthropic and ChatGPT, so that they actually create that default spine and make it very easy with gorgeous interfaces. And they've got a lot of money to spend on developers and they roll things out so quickly. That might be where this could head, that they develop that interoperable layer that other healthcare systems can plug into. I don't know. I'm just proposing.
Yeah, look, that's a possibility. And if they can demonstrate doing that, then that puts them in an enviable position. But at the same time, I'm sure the other players aren't sitting on their hands waiting for these guys to overtake them. So there'll be lots of dynamics in the market about what these solutions look like. And then we need to think about, what are the resultant overheads. So if we do have this big central spine that has every bit of information about everybody sitting somewhere in a secret data center under a mountain somewhere, big earthquake, and what happens? Is that information gone? How do we manage that information? There's all those sort of risks we need to take into account. And at the same time, we talk about disintermediation. Do we want a centralized database or do we want everybody to be responsible for their own data? And if they're going to play a more active role in decisions around their healthcare, they should also play a bigger role in managing their own data. So maybe we need to think about this model of people spending more of their own time and effort managing that. As AI replaces jobs and we don't have to work 40 hours a week, maybe we can focus more on our health and think how we can deliver ourselves a better healthcare experience.
Yeah, that's what I'm going to do with my universal basic income time.
Exactly.
Yes, organise my photo collection and the 40,000 photos I have on my phone. Plus, I will sort out my healthcare records as well.
Yeah. But it's interesting, again, if we start talking about shared responsibility, then there's a requirement for shared action. And maybe that's how we solve the privacy issue. Everyone has their own health record and they decide who they want to share it with. I remember many, many years ago, back in the early 2000s, the concept of the personal health record was a USB stick. You took your USB stick and you stuck it in someone's computer, and that's how you shared your record. Maybe now it won't be a USB stick, but it'll be a token which opens up that access.
Yeah.
There's lots of opportunities here we need to start thinking differently. This is not the healthcare as our grandparents knew it.
No, or as we know it. Yeah. Let's have a chat about the business models, George, because I think the real story here isn't which chatbot is better and where it might go in time, but I want to talk about how money moves when AI becomes this incredibly powerful interface layer. So one of the things I was thinking about is that the front door to healthcare is changing. We're using that term more and more these days, and I think it's already changed. So sorry, government or big player that thinks you're going to be the front door. I'm sorry, but I anticipate that the front door to healthcare has now changed. Well, it will in very short time. So if consumers like you with your dermatology issue, they're going to start with a chatbot, then I'm sorry, but it becomes the AI assistant that becomes the front door to healthcare. This has huge power. So the winners then, being the chatbot, whichever ones that might be, they are the winners here. They control how patients, clinicians, and organisations enter the healthcare system and what happens next. The thought of this is terrifying because of all those other things we've discussed, lack of regulation and oversight. It's very much a black box, but I could see that happening. And then, of course, the losers in that system pay some sort of referral tax. And this is very non-healthcare language: marketing, lead generation, platform fees. So, for instance, I sit on the board of Asthma Australia, and we've been having discussions about we really need to completely overhaul our website because we built our website for humans. And we built it using SEO models that hopefully when someone has a question about asthma, the SEO links them to our website, and we've created a website that is good for humans to read. That completely needs to be torn to shreds, and we need to build a website for chatbots so that when you go to ChatGPT or Claude and ask it about asthma, it actually gives you links and through that you should talk to Asthma Australia, and here's the services Asthma Australia can help you with, that sort of stuff. How do we do that? How do we build our information for a bot rather than a human? And then I think if using Asthma Australia as an example, you can think about it for any aspect of healthcare. If we are the incumbents, being the traditional healthcare system, I think we are at huge risk, and I don't agree with this, but I think it will happen. We're at huge risk of disintermediation unless we change the way we do things and that we integrate into this new world and try and anticipate where it will go. Because otherwise, using my asthma example, you do a search, George, and it doesn't even mention to you that Asthma Australia exists and it's got these fantastic recommendations and fantastic resources. You might never, ever know that we exist. And that's not going to be good for people with asthma. It's certainly not going to be good for Asthma Australia either. So what do you think about this changing the front door of healthcare?
So it's interesting. I remember a few years ago when things like Hot Doc first came out, where you use those to access your GP. So they become the front door to GPs. And there was a question of whether they would control who has access to GPs. Now, we saw recently Hot Doc got sold for $250 million here in Australia because of that way that they control that environment. So this may well be the way it works. There may be multiple takers of that money associated with healthcare delivery. So whether the front door takes a cut, does the front door, like the old bouncers in the clubs many years ago, they decide who comes in and who stays out? And is it a pay for play? Is only those who are able to pay? We already see in America that some hospitals won't take you if you don't have the requisite insurance. Will the same sort of thing work with this front door? Again, this is where we probably need the front door to be controlled or governed by an overarching authority which has the good of society at play rather than the profit motive. And that's probably one of the challenges we face. I don't know if you ever watched the old Godfather movies. The mafia, according to those movies, made a cut of every transaction that their people who worked under them made. If you keep on increasing the size of that cut, does that mean the person delivering the care gets less and less and the middleman gets more and more? There's all these sort of business models that need to be understood. In the US, it's very different over there. We talk about their $4 trillion market, but only about $1.5 trillion of that actually goes to the healthcare providers. The other $2.5 trillion goes to the things around it that don't necessarily deliver healthcare. So this is a possibility. The other thing, of course, is that the delivery of these services, whilst at the moment is free, I don't know about you, one of my sons wanted to buy some new RAM chips for his computer. He's got 32 gig. He wants to upgrade his memory to 64 gigabyte to enable him to run these AI tools and do whatever. RAM has gone up 400% in the last year because of the demand. Yeah. So the last set of chips we bought were like $120, and the same set of chips we looked at now are all over $400. This is changing a lot of the dynamic. The business models are affecting various different parts. So if ChatGPT Health is sitting on a bunch of very high spec, very well rammed computers, that we're talking billions of dollars worth of hardware which needs to be amortized because it doesn't last forever. You've got to replace it at some stage. So I think that's going to really change the business model as well. Once we realize what the actual cost is, let alone the environmental cost. We can spend hours talking about the fact that these new data centers are going to basically chew up all our electricity, and the only way we're going to power them is through coal power for the time being, and there's all that sort of discussion. Well, yeah, there are consequences to our actions, and maybe going forward as quickly as we are, we don't realize what those consequences are until it's too late. So I think we need to maybe take a step back every now and then and relook at where we're up to.
Yeah, yeah. And it's a whole other conversation, but I met a nuclear physicist, strangely enough, as you do when you're wandering the streets of London, and ended up with a great conversation around investing in fusion and where is a lot of that investment money coming from? AI. Like even Sam Altman, I think he's invested $375 million of his own money to back fusion research because they're looking, we need power. We're not going to dig up enough coal to get this done. There's not enough sunlight. So we need it fast and we need it cheaply. And so there's a whole nuclear fusion aspect to this as well.
So I've been watching the World Economic Forum discussions from Davos over the last couple of days. And there's been some really interesting discussions. So people like Elon Musk are now talking about satellite-based AI data centers because, again, they got access to 24 hours, 7 days a week sunlight to power those sort of things. There's a whole bunch of really weird and wonderful things happening. Again, we need to start thinking about what are the codependencies on that. What happens when we become reliant on a satellite-based AI system and there's a solar storm which knocks them all out? Again, it makes the perfect story for a bunch of science fiction series, I'm sure, but the reality is that may happen. Some things we don't control.
Yeah, yeah. All right. I think the other thing from a business model perspective is data aggregation. Data aggregation is clearly where it's at. And for 20 years in healthcare, we've been talking about we need these EMRs so we can digitalize our health information. Fast forward 20 years, a lot of us are still having those same conversations and we're not quite there yet. We're still using a lot of paper. But to really take advantage of these new tools and deliver value to the healthcare system, to clinicians and to consumers, we need data to be digitalized and we need it to be aggregated. And hopefully we'll fast forward efforts to deliver meaningful value to consumers and clinicians and enterprises. And we really need that unified record, that spine type concept that we discussed earlier. So I really think the race is going to be on to solve things like identity matching, longitudinal history, provenance, trust, coarse consumer consent, and ideas of the traditional timeframes around decision making with these things and investment in the infrastructure that's required. I'm concerned that we are already way behind where we need to be. And if we don't pick up this pace and change what we do regarding business models, there will be private enterprise which will be able to make more significant gains in this, and we are at risk of creating even more inequity in our system in terms of who has access to information and the value of these tools, whether that's for a clinician or a consumer. What are your thoughts on that one, George?
Look, the inequity issue, I think, is going to become front and center because the reality is as these tools become more necessary for the delivery of care, those who don't have access to them, be they third world countries, be those people who don't have the right digital literacy skills, be those people who can't afford a 24/7 100 megabit internet connection in their home. These are all sort of issues that are going to drive this change. So is government's responsibility to control this? It probably is to some degree, but the reality is if we allow the free enterprise to be the purveyor of all these solutions, their responsibility is also to their shareholders. So they need to look at how they maximize their revenue as well. So, they talk about the third or fourth industrial revolution, the dollars and cents need to sort of balance out at the end. And we haven't quite worked out how that's going to happen yet. We're sort of working on this theory that the technology and innovation will progress so rapidly that that doesn't become an issue. But at some point, we do hit a hard stop.
Yeah, that's right. Okay, so let's discuss some key takeaways from our conversation. So I'm thinking, okay, why is this such a big deal? And I think the key reason it is a big deal is because it's not so much about the tools themselves or who's released these tools, but it really shines a light on the tension that we have in our healthcare system between consumer empowerment and the readiness of the health system to work differently and to truly be patient-centred. Now, because we still haven't worked out good ways of doing that because of the immense complexity of the healthcare system and our traditional ways of funding it. Consumers, though, they're now going to be offered a way to take control of their own health data across numerous sources. And traditional healthcare, we're not ready. We're not ready culturally. We're not ready at an infrastructure level. And we're certainly not ready at a business models to respond, let alone to lead this. So I think that tension and the exposure of that is something, is a key takeaway for me.
Look, you're right. And it's a revolution, and revolutions can be bloodless, they can be bloody, and we don't know which way this is going to go. There's going to be people who benefit from this, and hopefully that's the consumer, because at the end of the day, healthcare is all around improving consumer outcomes or patient outcomes. But there's also going to be those who suffer. And does that mean the current model of medical training needs to change to take into account technology more effectively? Even now, I speak to my colleagues who teach in the medical schools, and digital health is a 1-hour lecture in a 5-year course.
Yeah.
The models of care and people have to then develop those skills afterwards. And kudos to people like Heiser who produce things like Cheer or whatever, but this is moving so rapidly now that you can't develop courses to keep up with it, because by the time you do, the world has changed. Hopefully the healthcare environment will adapt, and maybe we need to give it a bit of a room to adapt, so rather than trying to push it through too emphatically. But at the same time, they need to realize that the power differential between consumers and providers has radically changed. We now are sitting on pretty much level settings, and that means big changes in the way we deliver healthcare.
Yeah, it does. All right. Hold on to your hats, everybody. Okay, so another key takeaway is that it's a common saying. I hear the same thing around the world. The airline just changes, but you often hear at healthcare conferences that, we run more pilots than Qantas or Ryanair or whatever, depending on your jurisdiction on the planet. But I think this shows that big tech companies, not the healthcare tech companies, but big tech, they're moving from experimentation, and they're doing it quickly. They're moving from experimentation to actual product lines in healthcare. They're bypassing all of the traditional barriers that have been at play for traditional vendors in the system. They're going to direct to consumers with free products that they can make use of 24/7. And so I think it's something that we need to consider, that it's moved from experimentation to product lines, whether that's direct to consumer or the direct to enterprise models. And we need to work out how we're going to respond to that. And I'd like to think that we're not just being responsive, but we're being proactive. But I don't have a lot of faith in the healthcare system to be proactive, not because we don't want to, but because it's complex and traditional and full of wickedly complex problems.
Oh, what's that classic Mike Tyson quote? Everyone has a plan until they get that first punch in the face. We don't have a plan. We're getting punched in the face. We're developing a plan whilst getting punched in the face. So I think we need to probably have a chance to sit back and think about some of these things more effectively. But that requires us to have academic researchers who are doing the work around this and developing these spaces and having these discussions in public forums and engaging with them. But the sheer pace of change is amazing. 2 years since the launch of ChatGPT, we now have ChatGPT Health challenging the way we deliver healthcare, which is something which evolved over 2,500 years. This is really a revolutionary change.
Yep. I'll put that down as the third takeaway then. This is drastically disruptive and it's happening fast. And the consequences for this are not all positive, but there's negative and positive consequences there. And I think we really need to be paying attention.
So governments need to play a role, employers need to play a role, professional bodies need to play a role. They all need to get engaged in these technicians, but we can't just let it be continuously ongoing discussions. Some people need to make decisions about this. And the ultimate decision maker for their own individual requirements is the individual themselves. So take that into account, that individuals will be making their own decisions, right or wrong. Some people will make good decisions. Some people will make bad decisions. That's the reality of the world. At the end of the day, people are going to become much more responsible for their own healthcare decisions.
Yeah, no, absolutely. I think another key takeaway is that the competition in this space, not just the disruptive element of the new vendors that are playing in the space now, but even amongst AI companies themselves, the competition isn't just about model quality. We'll talk in the next show about open evidence and their big news because they just keep getting worth more and more money. But there was no time to really fit that into today's show. But it's not just about model quality, though. It really is. And I think that's the play ChatGPT are going after by being so aggressive, is we're talking about distribution regulation, compliance, like the HIPAA compliance stuff and everything, and also integration into workflows. There's going to be a lot of competition here.
And there's still a couple of big players we haven't heard from. Maybe next month we'll be having the same discussion about a bunch of other big players coming in. The reality is there's the big technology companies, but there's also big infrastructure companies, and there's a whole bunch of people who need to collaborate on this.
It will be. Okay, so another thing I was thinking about, that the traditional focus when we talk about digital health and technology implementation within the four walls, the four metaphorical walls of healthcare, it's always been our focus. Of course, that's been the focus, but it's not the main game in town anymore. I don't really think it's up to healthcare institutions to decide how AI will be used. And I know that's out of context. Someone will probably send me hate mail for saying that. But what I mean there is that consumers won't necessarily see traditional healthcare as the front door to healthcare anymore. They're not going to wait until government or my favourite clinician gives me advice on what to do. Consumers generally are going to access information differently. They're going to expect much more from the healthcare system. And it concerns me as well. Like I'm concerned that traditional healthcare might end up being seen in the same way like a mechanics or a hairdresser, like somewhere we go when we need someone to physically do something to us, like surgery. I don't see people lining up for Elon's surgery robots anytime soon, mostly because they're a completely myth. And that's not good. That's not good for healthcare. But I do think it's something we really need to be considering, because regardless of what government or healthcare system policy comes up with, how we're going to use AI and how we're going to govern it, regardless, consumers, they're going to be doing this stuff and they're going to be bringing themselves into traditional healthcare with different expectations and armed with a bunch of information. Some of it will be misinformation, but some of it will be really good. They're not waiting for us to make up our minds.
Yeah, and it's interesting because what does that mean for those sort of rare diseases or those cases that sort of sit in the intersection between various things? And that, is it the best marketed healthcare service that gets the most attention? We've seen the advent of a lot of these online telehealth services that are very condition specific, be they weight gain, be they sexual issues, be they whatever. Does that fragment the market more, that we have a specialized service that uses AI for weight loss, but that's separate from the specialized service that manages your diabetes, even though the two are related?
Yeah.
There is that possibility of this will actually increase fragmentation because the barriers to entry have been shifted. They're made both easier in some regards, but also harder in other ways once you're an incumbent in place. So, yeah, there's going to be a lot of market dynamics that we've never had to deal with in healthcare. We've never had to think about it, especially in countries like Australia, where, up until now, most healthcare has been heavily subsidized by the governments. The market dynamics have been flavored by that. In this brave new world, that changes radically.
Yeah, absolutely. Okay, another takeaway. Who owns the patient relationship? Now, if you look at the language a college like the RACGP here in Australia, they use, I think they would say that it's their members. The GPs have always been that front door to healthcare and determine whether you need a referral to go see the dermatologist or whatever it might be. So I think organisations like RACGP would say it's our members, it's GPs that own the patient relationship. And I don't think that's necessarily a bad thing. But in order to keep that position, if that's the frame of reference you're coming from, if you want to keep that position, you're going to actually really need to change how you practice and the nature of your relationship with your patients.
Absolutely. So do GPs own that position? Yeah, they need to earn that position. They can't just sort of say, because we're the gatekeeper, because you need us to get your scripts or you need us to get your referrals, we manage that, we own that relationship. The GP of the future is going to have to be a very different entity to what it is now. And it may well be that it's 85% AI and 15% person. There's different hybrid models coming into play. But the reality is individuals will be making decisions about what services they access based on what they think is right, not necessarily what the GPT tells them, unless the GP builds such a strong relationship. And you don't build relationships with 6-minute consults, you build relationships with continuous ongoing communication. Do we need to start looking now at asynchronous models of general practice where we're in constant communication? Do you open your kimono and give them access to all your information, discuss decisions with them? But again, they need to work out how they're reimbursed and we need to work out how we pay for that service.
Yeah, absolutely. All right. We are going to be talking about this for a long time yet, I think. And feel free, anyone's got any hate mail, just send it to me, not George. I will respond. Okay, finally, as a takeaway for me, George, is the business model impact. It is real. It is going to be very tangible very quickly. And I think whoever becomes that front door of healthcare and who can own that workflow layer really has the opportunity to reshape things like margin, which is a very non-healthcare word, but it does come down to dollars and cents. We make decisions all the time about what we're going to fund and what we're going to pay for. So I think that whoever wins this can really reshape that margin, demand for healthcare services, and of course, trust as well. And some of this stuff is exciting, but I think some of it's also a little terrifying.
The business models discussion is going to be an ongoing one. And the reality is we've seen things like publishing, we've seen things like entertainment, we've seen things like advertising. 20 years ago, the Sydney Morning Herald on Saturday had hundreds of pages of classified ads which no longer exist. That's a business model which has changed dramatically because of online tools. What it's going to look like in healthcare, I don't know, but it's definitely going to be different because people are going to have to adapt to the technologies in a way that optimizes the delivery of service. Does that mean we don't longer need more doctors because doctors will be able to do more? Doctors are burning out at a rapid rate. I caught up with a couple of friends of mine over the holidays who are GPs now, and these are people who used to love their job. And I have to tell you, a couple of them weren't not as happy about their job anymore. Things are changing. So when you look at young graduates, the first conference they attend is Creative Careers in Medicine. They no longer attend conferences about how to become a physician. They attend conferences on how to get out of the medical system and make some money elsewhere.
Oh, we do love Creative Careers in Medicine, that community. But
Amandeep, you have a lot to report on for. You're making people rethink their career choices.
Yeah. All right, George, time for a quick break. When we come back, we are going into George and my predictions and what this all means, and also provide you with a bit of a to-do list of what we think, who's going to have to do what and when. And spoiler alert, when is now. So we'll talk to you soon. Welcome back, everybody. As promised, George, you and I are going to go into some of our predictions in this space of AI and its disruptive potential for healthcare. And we're also going to talk about the things that different groups and individuals need to be doing now. One of the first predictions, I'll get us started, is I think the trust that people have in these direct-to-consumer tools are going to really reshape the nature of our relationships with clinicians.
Yep, I agree. Trust is a central item across this whole thing. And the reality is, if some of these systems demonstrate lack of trust or become non-trustworthy, that's going to change the whole equation as well. So whilst we're working on the theory that these guys are going to do their best to maintain the trust, as they say, bad things sometimes do happen. And that's going to...
Oh, yeah, it's not going to be perfect.
That's going to change the environment. But yeah, trust is going to be core. At the end of the day, people are going to want to trust that these systems are working towards their benefit, not towards their detriment, nor do they want to just be seen as a financial cog in the wheel.
No, that's right. To have a tool, a chatbot that is 24/7 available to you, and I'm sure all listeners of Pulse have had at least some degree of exposure to these generative AI tools, and they're nice to you. And we've discussed the relationships that people feel that they have with these AI tools. And again, these tools are just going to keep getting better. Like the tool that I use today is going to be the worst it ever is, barring some like malignant code that goes through it and breaks them. If we look at how people are going to form trusting relationships with chatbots, whether we think that's good or not, the literature shows they will. What does that mean for the relationship that me as a clinician has with my patients?
It was interesting because we are taught when we go through med school that empathy is the basis of trust when it comes to these relationships. And whilst AI tools don't have the same type of empathy that a human being has, the reality is if you're accessing them via a screen or via a mobile phone, you can't see whether the face behind it is empathic. And the empathy scores of some of these AI tools is up there as high as some of the most empathic people out there. Whether it's, call it pseudo-empathy, call it simulated empathy, but the reality is people enjoy their interactions with them, and that's going to help build on that trust.
Yeah. I like synthetic empathy. That was the term we used before. Yeah, I like that term. But again, I don't know whether people care.
And the reality is not all doctors are empathic. I don't know if you ever watched the old TV series House, but House didn't have empathy, yet he was considered to be the world's greatest doctor. So maybe empathy is overrated.
I know, that's what I want to see, a new season of House versus ChatGPT.
Yeah.
That's a show I tune into.
I am told that one of the new episodes of The Pit includes a discussion around AI scribes. I haven't seen it yet.
Oh, great. I love The Pit so much. And I know so many doctors do. And it's rare that you can have a show that is about the industry that you work in that doesn't cringe. I love The Pit, but I'm waiting. When I was introduced to it, it had already finished. So I binge watched it. I spent a whole weekend and just watched 15 hours of television because I have no life. I loved it so much. That's what I'm going to do. So I'm going to hold off watching The Pit until it's finished. And then I'm just going to go, I've got nothing to do this weekend. I'm going to watch The Pit.
Remember the good old days when we used to wait till 8:30 on Monday evening to watch a show and then wait 7 days for the next part? Gone are those days.
Yes, no, gone are those days. Okay, so another prediction that regardless, again, whether we think this is a good thing or not, this is going to quite quickly create additional pressure, which is the last thing we need, but additional pressure on clinicians and on healthcare organisations, whether that's to change our workflow, to answer questions, to combat misinformation, but also, as I mentioned earlier in the show, to generate and share full information with our patients and to give it to them with a degree of urgency or immediacy.
Yeah, look, and I think this is going to be a central change, that if these AI tools need access to the information, then the healthcare providers and the healthcare organisations are going to need to make it available. The reality has been that up until now, the one thing that's impeded that has been their own sense of superiority and their own business models, and those will need to adapt to the fact that the information really does belong to the individuals who it's about, and they have the right to it in real time if possible.
Yeah, absolutely. All right, and a third prediction, again, back to pressure. There's going to be additional pressure on governments, whether that's federal or state, who, let's face it, they're already in policy catch-up mode when it comes to AI. And so they've already got that pressure on them. They're in catch-up mode on policy. Also, many of our healthcare systems, which are funded by government, are also in catch-up mode on building the infrastructure that will enable the digital capture of our health information. So it has to be firstly captured digitally, and then it has to be able to be shared digitally. And I think the pressure on our healthcare systems to enable that, those policies that are required, the rollout of EMRs and other tools, I just see a lot more pressure and the timeliness of this. And I don't know how you can fix that because these things take a lot of money and a lot of time.
Look, we have at least taken the positive step of having a chief digital information officer in our Department of Health. So we are, at least have some of that infrastructure in place. But the reality is the Minister for Health, his role has significantly increased over time. Now they cover disability and ageing as well. So they've got a really big remit and they need to dynamically adapt to the environment that's out there. I think Mark Butler probably deserves a pay rise.
Popular opinion? Probably not. Okay. No, thanks, George. Do you have any further predictions?
Look, it's going to be a dynamic time of change, and we're probably going to look back on it at the end of it all and see things that we know we should have done, but there were frictions that slowed it down. But I think society and humans are innovative people. We will adapt to them. We will produce better solutions. And ultimately, in 2050, when we're having this same discussion, we're going to look back on 2025 and say, that was a great time of transformation, but hey, look how much better our quality of life is now, and we're all living to 140 and our health span is 139 and we've worked it all right, and we first heard about it on the Pulse IT podcast.
Yeah, let's hope we get there quickly, George. Okay, now let's focus on the to-do list that we promised you all. So what can we do collectively and individually to maximise the opportunities of these developments, but also to minimise the harms, to minimise the risks? So I've got 6 that I have listed, and I've broken them up to particular people that I'm addressing them to. But firstly, this one is for everybody, which is don't ignore this development. This is why George and I put this show, it's turned into 2 shows together. It is our responsibility here to keep informed at a minimum. Please read other things, like consume as much information about this as you can. Share this podcast episodes with your colleagues, with your boss. Make this an agenda item at your department meetings, at your board meetings. Have the conversation conversation and do your bit to start thinking through the complexity of these issues, because I don't think our approach of, no, not happening here, I'm just going to continue on as is, I don't think that's really going to be a viable option.
Using the analogy of the summer going down the beach, you can either ride the wave or you can get dumped by the wave. It's important that you actually stay on the wave and keep across it. And that's going to require you to keep on researching. Listening to us is great. There's lots of information being made available. To the credit of the large tech companies, they're making a lot of their information publicly available as well. So when they launched ChatGPT Health, they released a lot of information about it very early on. So keep your eyes open, listen, read, watch, and keep engaged.
Absolutely. All right, number 2, this one is particularly for governments, federal and state, but citizens are going to need guidance. We need to educate consumers differently. And I do think this is urgent. The horse is about to bolt. We want to learn from the, let's say, not necessarily mistakes, but maybe naivete that we had around social media. And fast forward, 12, 13 years later, and we've had to pass legislation because we're like, hey, this stuff is not good for kids. We need to get kids off this. So we want to learn from those errors and actually move quickly to educate and guide everyday consumers, young people and old people alike, about how to engage with these tools, how to critique them, things to be aware of. And I do really think this is really quite urgent.
Absolutely. Look, digital literacy is a backbone of making this happen more effectively. We can't just expect consumers to ride the wave without having the right training. So the government's got a responsible role here. You're right. We can't pass legislation 20 years down the track saying healthcare systems are now being reconstrained back to the 1800s because hey, we don't know how to do this new system. So we need to stay informed and have a centralized body like the government whose role it is to manage that experience.
Right. Employers of all descriptions, you need to educate your workforce. You need to create policies that support how they can service the demand that's going to change and how they actually move with patients' expectations. And that's not just for clinicians. Obviously, they have the direct interaction with patients. But I think regardless if your workforce is clinical, administrative, project management, technical, executive functions, we really need to make sure our workforce is across these issues and put policies and systems in place to support them, where there's still going to be a lot of grey and things we don't know. And while we could educate ourselves and have our best predictions of where this might land, I don't really think it's going to land anywhere particular. It's the journey that's important, and that journey is starting now. I think we really need to pay attention to helping our workforce through this.
Absolutely. And these aren't just policies that sit on a shelf. These are policies that are dynamic, that actually interact with. And again, this is where the software systems enable you to make sure people know what those policies at the point of care.
Yeah, absolutely. All right, now this one is for the professional bodies. Love to RACGP and the other professional bodies. All of you have a really important role. You have to, again, educate your members, your fellows. We have to consider new roles, particularly for clinicians, and changes to that patient-clinician relationship. Ask the question and answer the question. What competencies, what capabilities is a clinician going to need in this new era? And how do we support them to get ahead of the game and also to lead this change rather than just passively accept these changes happening to them? So I think that's a really great opportunity, but something that needs to be grasped earlier than later.
You and I were both at the RACMA conference late last year in Perth. And again, organisations like that need to play a greater role. So we've got the professional colleges around the subspecialties, and they still need to focus very much on the care models, but the other organisations around them, and RACMA's a great example, that we're going to have new skill sets that don't exist. Not every surgeon needs to understand the intricacies of technology, but they need to have someone they can refer to or relate to who can help them in that journey.
Yeah, absolutely. All right, this is for everybody that is in an executive leadership type position, governments, healthcare organisations. revisit your digital health strategies. You know how you have that document and you said, okay, well, this is our strategy to 2028 or 2030. You should probably be revisiting that now. Many, if not most, of your digital strategies are going to need a rewrite for this new age of AI. And we're really going to need to start focusing on getting the data layer of those strategies, getting there sooner than later. And interoperability is even going to be even more important than it ever has been.
Yep. Ultimately, you have to define what the goals of your strategy are, what you want to do. And if it's all around delivering the highest quality services we can, but taking into account that the underlying infrastructure is changing rapidly and you need to be able to adapt to it. And now you may well ask ChatGPT to help you rewrite your digital health strategy, but I think we probably should get a few people around the table to have that discussion as well.
That's it. There's some stakeholder engagement you can do as well as asking ChatGPT. Okay, and then good news for researchers. You're looking for things to do, research community. Here you go. You've got a big bucket list now. You need to be out there and working out ways to collaborate with technology vendors, the AI companies, and of course with health systems. You need to build the evidence and you need to get to work now.
So call out to government organisations. The Medical Futures Fund is underspent at the moment because it's very much focused on old models of healthcare. So we need to maybe think about how we use that money to develop new models of healthcare and adapt to it. And there's some brilliant researchers out there and there's an opportunity for more people to get involved in this. And ultimately, everyone involved in healthcare should have a strong interest in the research involved in delivering care. Back to the good old days of the clinician scientists where the same person who delivered care also did the research about how the care is involved. We do have systems in place now which enable us to take that information from the masses and build on it. So evidence is the key here. The way we avoid misinformation is to make sure any information we make available has an evidence base behind it.
Yep, absolutely. All right, George, have we got anything else to add to the to-do list for people, or we think we've just fire-hosed everybody and they're scared, excited, they're going, no, I don't want to know.
So look, the only thing I can say, there's a lot happening, but don't be afraid of it because the reality is humans have adapted over time and good old Darwinian evolution tells us those who adapt will succeed and those who don't adapt will become fossils. And if you want to be a fossil, don't adapt. If you do want to be part of the change, learn to adapt and it's going to be an exciting time. And at the end of it, like I said, the goal is for us to have a better system and I think we have the opportunity to deliver on that.
Oh, yeah, absolutely. George, it's just been a pleasure chewing the fat with you on this. And hopefully people have found our analysis of these current developments enlightening and adding value to thinking about what they need to do to adapt, as you said.
And like I said, this is an ongoing journey. So if you have any ideas that you think we should be discussing, please reach out to us either through LinkedIn or through email. But I think we really need to be having this discussion now rather than reflecting back on it in the future and saying, gee, we had some lost opportunities there. This is really an opportunity for us to make those major changes we've been talking about in our healthcare system. AI may well be that enabling tool which we just haven't had available up till now.
Yep. Yeah, that's right.
But if you have any spare RAM chips, let me know.
Yeah, send them to George's place. Your son needs them. George, we have so much content we can make this 2 times a week show. If anyone wants to sponsor the pod, if you think your organisation would love to get involved, we do have a growing and global listener base, then please reach out because it'll help us to keep bringing these episodes to you. So George, one thing, I just wanted to give a plug before we go. So our friend of the pod, Charlotte Louise, and her book, Dr. Bot, which we have discussed numerous times throughout various episodes, as well as an interview that we did with Charlotte back in 2025. So Charlotte is coming out to Australia on a book tour and her and I are hitting the road together. I'm just thrilled. So I'll put details in the show notes, but we are going to Glee Books in Sydney. So we're going to be at Glee Books on Tuesday, the 3rd of March to have a chat with Charlotte Louise and talking all things Dr. Bot. And then the following week, Tuesday, the 10th of March, we are going to be in Melbourne at Mary Martin Bookshop here in South Bank, which is like 5 minutes from my house, so I have no excuse to be late. We're doing these bookstore panels, talking to everyday people as well as some digital health people who come along. So we'll put links to that, but it'd be great to see you at the bookstore and you can also purchase Charlotte's book and get a signed copy of it as well.
So Dr. Bod has gotten rave reviews by many highly respected broadcasters. Eric Toffel speaks lyrical about it. I won't be here, unfortunately, for the Sydney event because I'm going to be overseas at the Global Health Collective event. But Charlotte's going to be in Australia for a couple of weeks. So we have already organised for her to catch up with a few other people. So I think if you get an opportunity to have a chat to her, she is quite an amazing person. And she's a real true life philosopher who's really philosophized this whole issue of how AI is going to change healthcare.
Hopefully see some of the PulsePod Australian listeners on Charlotte's book tour. All right, George, mammoth effort. Thank you so much. Before we go, if you could please read us out.
Thank you all for listening to Pulse, brought to you by Pulse IT News. Pulse is produced by Ivan Jurek of Octopod Productions. Special thanks to Emily Mara for her support. Big thanks to everyone for listening. Make sure you subscribe, follow and rate us wherever you get your podcasts. Visit pulseit.news to catch up on the news from Australia, New Zealand and Ireland, and send any feedback or topic suggestions to pulsepod@pulseit.news. We'd love to hear what's on your mind. Thanks, everyone.
Thanks, everyone.